Good afternoon from Winston-Salem, North Carolina. My name is Dr. Joe Adeboyega. I'm in a private practice up here, and I am also a licensed supervisor for a couple of therapists who are in practice in this area. I'm recording this video to help mostly, essentially, my supervisees who have not been able to attend supervision sessions because of the quarantine and what is going on, so that they can watch the video at home at their leisure and then gain credit hours for spending time to learn more about how to keep themselves safe and keep their family safe and progress in the profession. Now, we're going to be talking about COVID-19, which is what is actually the issue that we're all dealing with in America and in the whole world. Now, the COVID-19 is not just a disease by itself. It causes a lot of uh, issues, mental health issues for people, and there is evidence that there are people who have caught the disease either once or twice, and those people called the long haul are the people who, after they've recovered from the disease, continue to exhibit symptoms of the disease, so lingering symptoms of the disease. So I will talk. I will try to keep the video as short as possible, so as not to bore you with technical terms and so on. And this video could be useful to anyone as well who might be interested in the effects of COVID-19 and how to keep themselves safe, and as well as their family. Now, a short story about history about COVID-19 is that it's a new strain of coronavirus that has not been previously identified in human. And the COVID-19 is the cause of an outbreak of respiratory illness first detected in Wuhan, Hubei province in China. And this is why they said the Chinese discovered, even the doctor who first raised an alarm about it was arrested, and later he died of the disease before the Chinese authorities started paying attention to the severity of the disease. Coronavirus is a large family of viruses that are known to cause illness, ranging from the common cold to more severe diseases such as SARS and MERS. SARS is SARS, and MERS is MERS. SARS goes by severe acute respiratory syndrome, and MERS goes by Middle East respiratory syndrome. Public health authorities are learning more every day, and so the information we know about this, what we know about the virus in April, is not as good as what we know now, a couple of months thereafter. So we are learning more every day. Talking about the symptoms of the disease, here they say the symptoms start to show up, start to develop within 2 to 14 days. And that is why people are asked to quarantine for 14 days after they have been aware of the fact that they might have been exposed to someone who has the virus. Some of the symptoms are cough, fever, headache, new loss of taste or smell, repeated shaking with chills, shortness of breath, and muscle pain. So, once you start experiencing those symptoms, it will be a good thing to start to take precaution to either isolate or quarantine yourself so as not to expose others. And in most cases, it's been we've learned that people might be carrying the virus without knowing it and without exhibiting any symptoms. So they might be spreading it without knowing that they are spreading it. They might actually be spreading it to family members. No, what they ask us to do to protect ourselves is to multiple times a day wash our hands with soap and water at least for 20 seconds. Avoid close contact with people who are sick. Avoid touching your eyes, nose, mouth with unwashed hands. I think I'm guilty of that. I touch my face and ear and whatever often during the day. My wife said I'm not even aware of it. Clean and disinfect frequently touched objects. That is why in the stores you see, you observe that people wiping down the buggies and wiping down the counters and all the machines, just to make sure that the disease is not easily spread amongst the shoppers. So, in addition, they ask people to keep a clean environment, clean house, so as to reduce the spread of the disease. And the CDC is recommending that everyone do their part to help us respond to the emerging public health uh, threat. This disease is very serious. We have to take it serious. So we are asked to do the following things once you are aware that you might be exposed to the virus. First thing, if you are a healthcare provider or a public health responder caring for a COVID patient, please take care of yourself and follow recommended infection control procedures. I have discussed this over and over with therapists that it is essential that we take care of ourselves. If we are not safe, if we are not in good health, it will be difficult for us to help others. If you are a close contact of someone with COVID and develop symptoms of COVID, call your healthcare provider and tell them about your symptoms and your exposure. If you are a resident in a community where person-to-person spread of COVID-19 has been detected and you develop COVID-19 symptoms, call your healthcare provider and tell them about your symptoms. People who are still ill with COVID but are not sick enough to be hospitalized, please follow CDC guidance on how to reduce the risk of spreading your illness to others. People who are mildly ill with COVID are able to isolate at home during their illness. So, the quarantine thing is that as soon as you are aware that you might have been exposed to the virus, you are advised to endeavor to stay away from others, isolate yourself. So, here's the second point of why I'm recording this video. It is very important to note that when people are in isolation, when people are quarantined, yeah, that means they are reducing the amount of contact that they are having with others and the public. And this can be devastating to the mental health condition of people. Um, People who particularly recovering from mental health or substance abuse issues that have had the opportunity to be able to attend support group meetings here and there now have to do it by video or online. It's not the same thing like having that human contact where we meet in the group room, we hug each other, we shake hands, we laugh with each other. It's been tough on the mental health, and people have noticed that a lot of people are drinking more, a lot of people are using drugs to cope. When you are in isolation and all the news about the number of people who have died from the disease is going up every day. And they say about 3,000 people are dying every day as it is. And over 100,000 are diagnosed positive every day. So it's pretty frightening and worrisome that we all have to find ways to cope with the need to isolate, the need to keep away from others so that we will not spread the disease. So what to do what are the signs that you might be suffering from mental health issues during this time? Here are some things that for you to take note of. If you have fear and worry about your own health and the health of your loved ones, your financial situation or job, or loss of support services you rely on, you get worried, it start to affect you mentally. You won't be able to sleep. These are the things that cause you to be stressed. When you start to notice that there might be changes in your sleep pattern and eating patterns, you might not feel like eating because, first of all, you are not out there doing a lot of exercise. You are not out there at the gym or working up and down, going to places. So obviously, you are not expending a lot of energy, and that will affect your sleep as well as your eating patterns. If you have difficulty sleeping, which is likely to happen if you are stressed, or difficulty concentrating, if there is a worsening of your chronic health problems, like if you start to have more and more stomach or digestive problem, gastrointestinal issues, you may need to, then you start to notice that that is stress. That could be a major sign of stress that you need to pay attention to. So these are the issues, the signs that you might be stressed. If you are not sleeping good, if your eating habit has changed, if you are feeling more pain than usual, if your digestion is not as good as it used to be, if you're feeling tired a lot, if you are using more tobacco, smoking more. We do have a good friend who's 74 years old, single, white female, who no husband, no boyfriend, no children, and all she does all day long is smoke 2 packs of cigarettes, and she can go through 1 gallon of vodka, and that is worrisome. But she has nothing else to keep her alive and healthy but to drink. So more and more people are drinking, more and more people are using drugs to cope. But it doesn't have to be that way. You can actually do something else. You can exercise. You can go out and try to help people, which is altruism. That is, you feel good when you're out there trying to help people, trying to find people you can assist. Could be a neighbor that is older, that cannot get out. Maybe if you offer to go do some shopping for them, that could be something that will make you feel good. At least you're doing something to help a fellow human being. I was at the post office this past week trying to ship something to Canada for our grandchild, and this lady came from behind me while I was trying to struggle with the wrapping paper to try to wrap the package, and she said, "Step aside, you don't know how to wrap." Uh, I step aside. It's a lady I never knew before. Her name is Kelly Joe, white lady, big, nice girl. She helped me wrap the thing. I offered to pay her. She said no, she's not taking money, but she just wanted to do something to help a fellow human being. That is awesome. And those are the things we can try to do. Go to the park, go walk. I have one of my patients that has a PTSD from tour of duty in Iraq, and part of his daily routine is to go walk in the park, exercise as well. I have encouraged him to adopt meditation, daily meditation, which he does, and then he's cut back on cigarette and drinking, because whenever he was trying to feel good, he would drink alcohol, and that would set him off. So those are the things that we need to do. Try to find activities that you can do on your own. We call that finding a hobby. A hobby, something you can do on your own, so that you're not there watching TV all day long. You can sit down, either do some painting or do some drawing, or write poems or write stories that could develop into a book. So we need to find something to do to occupy our time instead of just drinking and using drugs, and so that we can better manage the symptoms of stress for being isolated or being kept away from others. That is my message for today. I sure hope that those supervisees who watch this video and wants to get credit for the time can give me the code of December 17 CDC COVID, and then I will know that they've watched the video. Then I can give them credit for the time spent. Thank you. It will be 1 hour, even though this video is only about 15 minutes long. Bye.